Hey guys, and I'm back with another video. So today's video, I just want to talk to you all about my breast reduction post-op. Well, I just had my breast reduction done on March the 25th. So 4 days post-op, 4.5, because tomorrow is what, March the 30th. So it's almost 5 days, and it's like probably like 10 or almost going on 11 o'clock at night. So, you know, 4.5 days post-op. So, yeah. I just wanted to talk to you all about just a few things. At first, I was a 38 double D, and it was just the breast was too big for my size. I'm only, 4'11", so I'm kind of, tiny, petite. So, it was good while it lasted, and I did love my big breasts, but it just had to go. Like, I feel better now because my back used to hurt a lot, and I used to have a lot of back and neck pain. I actually went to therapy for it. It's been going on for years. Like I said, I always, been big breasted, like big breasts running my family. So I done had my chest all my life. So, but I've been trying to get this surgery for about 4 years now. And I actually went to like physical therapy, and they did like, the lady, she used to massage my back and massage my neck and make me do, exercises and things of that nature. Like, I used to run on a treadmill and, you know, run on the treadmill. And I also used to use the bike and work out on a bike. And they try all type of, you know, they did these little suction cup things where they suction, my back and stuff like that with these cups. They did a lot of different like chiropractic methods, but still to no avail. My back, I was still having back problems and neck problems. So yeah, I have a good doctor. His name is Dr. Raganath from Georgetown Hospital in Washington, D.C. So he's a good doctor. He took good care of me. I'm still really sore, but this is, like I said, 4 days post-op, so I'm starting to feel a lot better. I'm walking around and everything is like going good. Of course, I have to wear this surgical bra. I have to go and see my doctor this week, so for him to tell me how long I have to wear the surgical bra, so he can help put more bandages and gauze and stuff around me, because of course I have two long big scars on my right and my left side. But I'm glad that I got it done now. He also did like a I guess like a breast lift as well. So he lifted my breast because, like I said, I was a 38 double D, and he turned me into a C cup. I didn't want to go too small, and I didn't want to stay the same size, because sometimes when people get breast reduction, sometimes they look like their breast is still the same size, or even look like their breast got bigger. My doctor also explained to me that like certain things that you eat, you gotta watch what you eat, because you can gain the weight back in your breast. Also, if you have another child, if you have another baby, you can gain the weight back in your breast. So just keep that in mind, kind of like stay away from certain foods and, certain, drinks and stuff like that, because you don't want the fat to go right back there, when you just got rid of it. But yeah, it was an extensive surgery, but I came out feeling, I was feeling like of course I was feeling sore, but I'm feeling much better, and it's only been 4 days, and I'm up walking and talking, and I had a wonderful nurse. She took good care of me. When I woke up, she had gave me saltine crackers and apple juice, and she was just so wonderful. The way she was talking to me, she said, your breasts sitting up so good, they look so beautiful, and your husband gonna love it, and so I feel like just what I have to say to people is do what's best for you. Don't worry about what anybody have to say. They might love your large breasts, but they don't have to deal with it. They're not the one that can't get sleep at night, or neck and back pains back hurting every day, they not the one that's carrying the weight. So although they might feel like the breasts look good on you and they might love big breasts, I'm talking about it could be like your boyfriend, your girlfriend, your friends, your family, but they not the ones that's having to deal with so much weight up top. And so you don't want to have to deal with it. So you got to do what's best for you. And like I said, I will be back like with another video as well, you know. But right now, I just want to, you know, tell y'all that this is one of the less painful surgeries I've ever been through. Of course, I haven't had like lipo or anything in the past. I've only had like you know, I had 3 C-sections, and I also had like a rotator cuff from a dislocated shoulder and like a hernia repair. But out of all them surgeries, like this one, I'm healing pretty fast. So, you know, I would have thought because it was such an extensive surgery and they had to cut me so deep and take all the, you know, the fat and stuff out of my breast that, you know, I would be in so much pain, but I'm really not. Like, I'm doing so much better. I want to thank my doctor, Dr. Ranganath, and also the good nurse that took care of me. I forgot her name, but she was such a sweetheart. Like, she really took good care of me and just helped me, you know, when I had to get up to go to the bathroom. She was right there by my side because, you know, some nurses don't be that nice, you know, they be kind of mean. But I had a really good nurse that really, you know, she really take her job serious and she really took good care of her patient, which was me. You know, she did a really good job. So shout out to her. You know who you is, girl. Like, we could be friends. You took really good care of me, and I like your vibe. Like, and like I said, if you all have any questions, you all can leave it down in a comment. And, you know, I will try to answer your questions to the best of my ability. I'm still learning as I go. Yes, you can go through your insurance. Sometimes it might be really hard to get the breast reduction through your insurance. Your doctor has to write it up a specific way for you to get it. You know, because like I said, it took me 4 years. Another doctor that I had at first, that I went to see another surgeon, he didn't write it up the correct way, so my insurance didn't approve it the first time. But when I went to Dr. Ranganath at Georgetown Hospital, he wrote it up the correct way. He knew everything to do to help me get my surgery, and of course, you know, my insurance paid for the whole thing. So you could, you know, you could go through your insurance and let the insurance pay for it for you. You just gotta go through, go with the right doctor, and they have to know how to write it up the correct way, you know. And just know, guys, like, whoever that's suffering, you know, from having large breasts, you know, we all been through it. A lot of, you know, there's a lot of big-breasted women out here, and if I can get through it, y'all can get through it too, you know. You know, I had to go through a lot before I got the surgery. I had to have like a mammogram done, and thank God everything was negative in my mammogram, so I didn't have, you know, breast cancer or anything like that. I had to have EKG and you know, chest x-ray and stuff like that to make sure I'm healthy enough to be able to get the breast reduction surgery. So I did have to go through a lot. You know, I had to make sure I had all my blood tests and everything came back, you know, negative. Everything came back right. So I was able to, my doctor was able to clear me, because you got to get a clearance. A doctor, your provider, your primary care provider have to clear you for surgery. So there's a lot of testing involved. You got to keep getting blood tests, EKGs and x-rays and stuff. And I also, like I said, had to get a mammogram, but it's all worth it. At the end, you know, my back could feel better, my neck could feel better, and I don't have to go through so much back and neck pain anymore, you know. And I like my size. Like, I didn't see my chest, and, you know, even though it's still swollen and sore, you know, that I see that my doctor did a really good job. And, you know, I want to thank Dr. Ranganath once again, you know, because you really did a good job, and I told you exactly what I wanted, and I didn't want to be so small, and I didn't want to be so big either. I just wanted to be just right. So he took good care of me, which he told me he would do. And I loved Georgetown Hospital because they kept my husband updated on everything. Every time when I was going back to meet with the anesthesiologist, they updated my husband and let him know that I was going back to meet with the anesthesiologist team. When I was getting my surgery, they updated him and let him know I was on my way to the surgery room. They updated him to let him know when I was in a recovery room and that I was doing good. And also my doctor called him personally, like he told me he would do, to tell him that I recovered well and I'm in the recovery room. So I love that hospital. They on top of their job. So, like I said, I just want to tell women that's suffering with like big breasts that, you all can get the surgery too. You just got to go to the right doctor. You got to do your research on doctors, do your reviews, and see if they have good reviews or bad reviews. And go to the right doctor and make sure they write it up the right, correct way. And, you could be on your way to having smaller chest and no back and neck pain problems anymore. So, we all gonna get through this journey. So that's all I wanted to say, guys. If you have any questions in the comments, please, link them down below in the comments. I will try to answer to the best of my ability. Like I said, this is my fourth day post-op breast reduction surgery. So I will be back to do like another video like in like a month or so, when I'm starting to heal more. So, like I said, if you have any questions, please let me know in the comments and I'll answer it to the best of my ability. Please like, share, subscribe to my video. Give this video a thumbs up. And I'll see y'all on the next one. Bye, guys.